Understanding anal fissures. Breaking the silence. Anal fissures are more common than you might think. Many people suffer in silence because they're embarrassed. It's important to talk about this condition. Open communication can help us understand, prevent, and treat anal fissures. It's time to break the taboo and have an honest conversation. Your health and well-being are too important to ignore. Let's shed light on this common condition and empower you to take control of your health. Remember, you are not alone in this journey. Together, let's explore the causes, symptoms, and treatments for anal fissures. Knowledge is power, and understanding is the first step towards healing. An anal fissure is a small tear. It happens in the lining of your anus. The anus is the opening where stool leaves your body. This tear can cause pain and bleeding, especially during bowel movements. There are two main types of anal fissures. Acute fissures are recent tears that often heal on their own. Chronic fissures are tears that last longer than 6 weeks or recur frequently. They may require medical intervention. Symptoms of anal fissures are usually noticeable. You may experience sharp pain during and after bowel movements. Bright red blood on toilet paper or in the toilet bowl is another common sign. Some people also feel a burning or itching sensation in the anal area. If you experience any of these symptoms, it's essential to consult a healthcare professional for proper diagnosis and treatment. Anal fissures often result from trauma to the delicate lining of the anus. Constipation is a common culprit. Straining during bowel movements puts pressure on the anal canal, increasing the risk of tearing. Diarrhea can also lead to anal fissures. Frequent loose stools irritate the anal lining, making it more susceptible to injury. Childbirth is another common cause, as the intense pressure during labor can sometimes tear the anal tissue. Certain factors can increase your risk of developing anal fissures. These include a low-fiber diet, chronic constipation or diarrhea, and conditions that reduce blood flow to the anal area. People with inflammatory bowel disease, IBD, are also more prone to anal fissures. Understanding these causes and risk factors can help you take proactive steps to prevent anal fissures from developing. Recognizing the symptoms of an anal fissure is crucial for seeking timely treatment. The most common symptom is pain during bowel movements. This pain is often described as sharp, burning, or tearing. Bleeding is another telltale sign. You may notice bright red blood on the toilet paper, in the toilet bowl, or on the surface of your stool. The bleeding is usually small in amount but can be alarming. Other symptoms include itching, a sensation of fullness in the anal area, and a visible tear or crack in the skin around the anus. If you experience any of these symptoms, don't hesitate to reach out to your doctor. While some anal fissures heal on their own with home care, others require medical attention. Seeking prompt treatment can prevent complications and promote faster healing. Section 5. Diagnosing anal fissures. What to expect at the doctor's office. Diagnosing an anal fissure usually involves a physical examination and a review of your medical history. Your doctor will ask about your symptoms, bowel habits, and any other medical conditions you may have. The physical exam is typically brief and involves a gentle visual inspection of the anal area. Your doctor may gently spread the buttocks to check for any visible tears or cracks in the skin. In some cases, your doctor may perform a digital rectal examination, or DRE. This involves inserting a gloved, lubricated finger into the rectum to assess the anal sphincter muscle and check for any abnormalities. If your doctor suspects a more complex issue, such as an underlying medical condition, they may recommend further investigations, such as a colonoscopy. This procedure allows for a more thorough examination of the colon and rectum. Section 6. Finding relief: home remedies and over-the-counter options. For many people, anal fissures can be effectively managed with home remedies and over-the-counter treatments. One of the most important things you can do is keep the area clean. Gently cleanse the anal area with warm water after each bowel movement. Avoid using harsh soaps or wipes, as these can irritate the sensitive skin. Sitz baths, which involve soaking the anal area in warm water for 10 to 15 minutes, can also be soothing. Over-the-counter stool softeners can help make bowel movements easier and less painful. Topical creams and ointments containing lidocaine or hydrocortisone can provide temporary pain relief and reduce inflammation. It's important to note that while these remedies can be helpful, they may not be sufficient for all cases. If your symptoms persist or worsen despite home care, consult your doctor for further evaluation and treatment. Section 7. Prescription medications and advanced treatments. If home remedies and over-the-counter options prove ineffective, your doctor may recommend prescription medications or other advanced treatments for anal fissures. Topical nitrates, such as nitroglycerin ointment, are often prescribed to relax the anal sphincter muscle and promote healing. Calcium channel blockers, typically used to treat high blood pressure, can also be used topically to relax the anal sphincter. Botulinum toxin injections, commonly known as Botox, can temporarily paralyze the anal sphincter muscle, reducing spasms and allowing the fissure to heal. For chronic anal fissures that don't respond to other treatments, surgery may be an option. Surgery typically involves a procedure called lateral internal sphincterotomy, or LIS. LIS involves making a small cut in the anal sphincter muscle to reduce tension and promote healing. Surgery is generally considered a last resort but can be highly effective in treating chronic anal fissures. Section 8. Surgical interventions for chronic anal fissures. While most anal fissures heal with conservative treatments, chronic cases may require surgical intervention. Surgery for anal fissures aims to reduce tension in the anal sphincter muscle, promoting healing and pain relief. Lateral internal sphincterotomy, or LIS, is the most common surgical procedure for anal fissures. It involves making a small cut in the internal anal sphincter muscle, reducing its ability to spasm and allowing the fissure to heal. LIS is typically performed on an outpatient basis, meaning you can go home the same day. The procedure is generally safe and effective, with a high success rate in healing chronic anal fissures. As with any surgery, there are potential risks and complications associated with LIS, such as infection, bleeding, and fecal incontinence. Your doctor will discuss these risks with you in detail before the procedure. Section 9. Preventing anal fissures, diet, lifestyle, and bowel habits. Preventing anal fissures involves adopting healthy lifestyle habits that promote regular bowel movements and prevent constipation. One of the most effective strategies is to consume a high-fiber diet. Fiber adds bulk to your stool, making it easier to pass and reducing straining. Aim to include plenty of fruits, vegetables, whole grains, and legumes in your daily diet. Drinking plenty of water throughout the day also helps soften stools and prevent dehydration. Regular exercise can also improve bowel regularity. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Avoid delaying bowel movements when you feel the urge. Holding it in can lead to constipation. By making these lifestyle changes, you can significantly reduce your risk of developing anal fissures. Remember that prevention is always better than cure. Section 10. The emotional side of anal fissures. You are not alone. While anal fissures are often discussed in medical terms, it's essential to acknowledge the emotional toll they can take on individuals. The pain, discomfort, and bleeding can be embarrassing, leading to feelings of shame, anxiety, and isolation. Many people with anal fissures are hesitant to discuss their symptoms, even with their doctors. They may avoid social situations or intimate relationships out of fear of embarrassment or discomfort. It's crucial to remember that anal fissures are a common medical condition, and you are not alone in experiencing them. Don't let shame or embarrassment prevent you from seeking help. Talk to your doctor, a therapist, or a trusted friend or family member. Sharing your experience can help you feel less isolated and more empowered to manage the condition. Section 11. Taking charge of your health. Seeking help and finding support. Anal fissures are a common and treatable condition. By understanding the causes, symptoms, and treatment options, you can take charge of your health and seek timely medical attention. Remember that early diagnosis and treatment are crucial for preventing complications and promoting faster healing. Don't hesitate to discuss any concerns you may have with your doctor. For more information and support, visit reputable websites such as the American Gastroenterological Association, AGA, and the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK. We encourage you to share your thoughts and experiences in the comments below. Your feedback can help others who may be going through similar challenges. Remember, knowledge is power, and together we can break the silence surrounding anal fissures.